Before we conclude, I would like to ask you one final question, but it will be, I think the answer will be very long, so I'm sorry. What do you think that there are hopes for the next decade for cannabis research and medical use? In your ideal scenario, what advances or changes would you like to see by, say, I don't know, 10 years from now?
Sure. So I think we're going to see new discoveries, new molecules that are discovered, new receptors that are being discovered related to the endocannabinoid system. There have been many unfortunate failures in developing single molecule drugs from cannabis, and so I'm not sure we're going to see a new drug being developed from a single molecule, large molecule. But there may be peptides. We now know that there are peptides, small peptides that actually have an effect on the receptors, and they're endogenous. So we know that there's a fraction of hemopressin, the hemoglobin derivative, that has an effect, and because it's naturally occurring, maybe that'll be something that we'll see. No one's developed an andamide into a drug. Maybe we'll see endogenous molecules developing into drugs. So I think we're going to see less synthetic drugs being developed from cannabis, but more approaches of either endogenous molecules like peptides being developed, or new delivery techniques that are being developed for the use of cannabis. And maybe there will be much more awareness of other cannabinoids, so we'll see standardization not only of THC and CBD, but of other molecules like CBG, THCV, and other molecules in the plants that will be in extracts, but with standardization not only of the THC and CBD, but of these other molecules that will be standardized and approved as products. So that's one thing. The other thing that I think we'll see is personalized medicine. It's obviously a very active area of research. Diagnostics becoming much more prevalent now after COVID. The whole diagnostic field has exploded with different diagnostic tools, and we're going to see more and more diagnostic tools that come to the market, including for the titration and optimization of therapy for cannabis and drug-drug interactions. So I think we're going to see that. Delivery systems, we talked about that. We're going to see, I think, new formulations, slow release, long-acting formulations, depots, so that you don't have to take the drug several times a day. Maybe you'll take it even once a month. So I know there are work groups that are developing that already. So it will become something that will, I think, go to the market in the next several years. On the other hand, you'll see inhalers with metered dose, similar to what we see in asthma. I think we'll see inhalers with metered dose, and also ways to communicate with the doctor with digital health platforms, so that everything is recorded and you could do the titration more effectively, either by the doctor, the nurse, or even maybe a bot basically communicating with the patient and improving their titration of the medication. So I think we're going to see that. Most importantly, I think we're going to see integration of cannabis into the standard of care, so it's not the last line of treatment. I think we're going to see much more of that. I don't know if that's the case now, but in several states in the U.S., you cannot go into a federally funded hospital in the U.S. if you're getting cannabis. You have to basically stop cannabis before you go to a hospital in the U.S. in some states. So even though you have a state-level prescription, because the hospital is federally funded, you can't go into the hospital, and they check you THC levels before you go in the hospital, which sounds crazy, but that's the way it was in Texas as recent as 2 years ago. So we're not going to see that anymore. I think that's going to disappear. I think we're going to see cannabis being used as a tool in medicine, in hospitals, and in the community. And
here,
And I'll
I'm sorry, but here you were talking about integration of medical cannabis like a standard care, but you mentioned also, what about medical schools? Because we should start teaching medical students also about endocannabinoid system.
Of course, I think it should be part of a curriculum in medical schools. It is already in Israel, for example. So it should be part of. It's an important part of our body. It's another system that exists in the body, just the immune system or the metabolic system. We now know, for example, we didn't talk about it. Cannabis actually is the only molecule that I know that reverses aging of bone density, so reverses osteoporosis. I don't know of any other drug that is in development or in the market that has done that. So there are uses that for these molecules.
CBD.
CBD.
Yes, in this case, for the
not
bone
only
density.
CBD. Even there's actually another molecule that affects the endocannabinoid system that's in olive oil. There's a study done on Greek women why they don't have osteoporosis. It's because of the olive oil. So the endocannabinoid system is important. It should be something that we are aware about it, and we teach it to the pharmaceutical schools. We teach it in the medical schools, and there shouldn't be stigma about it because it's not about being stoned and not productive. I think that's related to very high doses of THC, and I said that maybe that should be regulated, but everything else I think should be much less regulated and be used commonly.
So we were talking 10 years from now, so new indication and breakthroughs, innovations.
So I think the biggest breakthrough will be new receptors that we'll find. We already know of 2 receptors, but we actually know of more already that exist already in the body, and we'll find more and more of the interaction between the endocannabinoid system and other systems in the body. Just to give an example, the hormones that cause stress are affected by cannabis and vice versa. One of the reasons that cannabis, there's no upper limit for the effect of cannabis is because the precursor of cortisol, pregnenolone, is released as a response to high doses of THC, and it blunts the effect of cannabis, and vice versa. High doses of THC block the effect of cortisol. So there's an interaction of the endocannabinoid system and its receptors and cannabis with the hormonal system, the metabolic system, the immune system, and every other system in the body. So I think we're going to see more receptors that we discover, more molecules that have an effect either in the plant or in the body. So it's going to be part of our toolbox.
Exactly, it's very exciting time. You know that very well, that it's, I think, more than 300 scientific publications a day are editing regarding the medical cannabis science. So it's very popular and exciting field which is now related to medical cannabis. And as we conclude, we must to have we all like scientists, medical doctor, pharmacists, we have to have open-mindedness about medical cannabis. Think about the stigma that it's not a narcotic, and the science evidence data obviously is necessary to translate this data to patient and to daily therapies. As we conclude, we can remember that this landscape of medical cannabis evolving very rapidly, and we must stay informed as scientists about the new trends to just avoid to be overpassed. And just as information, yesterday France, as the first country in Europe, submitted the file to European Commission of the regulation how to valid the medical cannabis use widely for the patient. So probably 3 months from now, after the answer from European Commission, France will be the first country having finished product under marketing authorization access for the patients in France. They started also with the very skeptic approach with the pilot project in 2021, which was extended twice. And we see that after this slow and very, how to say, a strict approach to the medical cannabis, they will take a lead in Europe as a fully regulated medical products for the pharmaceutical products for the patients. So hopefully Poland and all the European countries will follow. Thank you very much for this very interesting discussion, Dr. Shmulewitz, and we are very happy to have you here with us.
Thank you.